Hi, my name is Tal Rodriguez, and I'm a nurse practitioner with the UCLA Mary S. Easton Center for Alzheimer's Research and Care. I'm here with you today to give you and your loved ones helpful information about the experience of patients receiving treatment through the UCLA Amyloid Immunotherapy Care program. Current treatments are for patients in the early stages of mild cognitive impairment or dementia due to Alzheimer's disease. Our treatments are lecanemab and donanemab at this time, both of which are approved by the FDA. In this video, we'll walk you through one of our infusion centers and let you know what to expect during our visits. At this moment, we're at the UCLA Clinical and Translational Research Center, which is one of our infusion centers. Before your first infusion, we will provide you a detailed handout with practical information that includes the address and hours of operation. Let's go check it out. Once you are inside, continue down the hall and turn right. We have a waiting and check-in area here. We advise that you bring a loved one with you, especially for the first 3 infusions of lecanemab. If you are being treated with donanemab, we advise that you bring someone with you for the first 4 infusions. Some optional things you may want to bring are a light sweater to keep you warm, a book to read, and/or music to listen to. A nurse or medical assistant will bring you to your infusion room and get you settled. Your room may look like this semi-private room. There are curtains for privacy, and you will have a chair to rest in during the infusion. The chair can be adjusted for your comfort. It also has a call bell so that you can reach the staff for assistance. Before your infusion, a nurse will check your weight, if required, and obtain your vitals. Once this is done, they will call the pharmacy to prepare your medication. This usually takes about 30 minutes. While waiting for the medication to be ready, the nurse will place the IV line. Once the infusion begins, you will rest in your chair. The infusion takes 30 minutes for donanemab and 1 hour for lecanemab. Monitoring is required after the end of each infusion. For the first 4 infusions of donanemab, you will be observed for an hour after the infusion ends. Starting from the 5th infusion, that will decrease to 30 minutes. For lecanemab, you will initially be observed for 3 hours after the end. For the 2nd to 3rd infusion, you will be observed for 2 hours. Starting at the 4th lecanemab infusion, the monitoring period will decrease to 30 minutes. Patients may experience an infusion reaction during or after the treatment, which is why patients are observed longer for the first 3 to 4 doses. Infusion reaction symptoms include, but are not limited to, flu-like symptoms such as chills, body aches, or feeling shaky. You may also experience joint pain, nausea, vomiting, dizziness, or lightheadedness. Other possible symptoms are allergic or hypersensitivity reactions such as a red, flat rash that may be itchy, trouble breathing, or swelling of the airway. If you have any of these symptoms, please use the call bell to reach the nurse, and medications will be given to treat them. It may take an additional hour or more to manage symptoms. Our team is skilled in handling infusion reactions and have extensive experience with these type of medications and clinical trial drugs. If you do not experience an infusion reaction during your first 6 months of treatment, we may not require an observation period after this time. When your treatment and observation period is done for the day, a nurse will remove your IV, a pressure band-aid will be applied, and you will be sent home. If it's your first infusion, one of our staff members from the memory clinic will come by and see you at the end of your observation period before you go home. If we are unable to see you at that time, we will plan to call you within 24 hours. We will let you know beforehand. To help you schedule your appointment, plan to be at the infusion center for approximately 4.5 hours for the first 3 infusions of lecanemab. Then, from the 4th infusion on, plan for approximately 2.5 hours. For donanemab, plan for about 2 hours for the first 4 infusions. From the 5th infusion on, plan for 1.5 hours. We have 2 numbers where you can reach us. One is for non-urgent questions. If you are concerned that you may be experiencing an infusion reaction or side effect of the medication, please call our 24/7 on-call provider available for help. Thank you for stopping by. We hope this video was helpful for you. If you would like more information, please look below at the description notes. It has phone numbers and helpful links, including the UCLA Easton website. And if you liked what you saw, please click subscribe. Stay tuned for more videos on the UCLA Amyloid Immunotherapy Care program and the treatments we offer.